many patients asking me what is better for weight loss, intragastric balloon, endosleeve, or pharmacotherapy, but I do not want to have bariatric metabolic surgery. Welcome to my YouTube channel. Let's focus on investigations on studies that compare both procedures. And there was recently published a study in one center that compared both procedures. But more valuable it would be if you have a look on meta-analysis. That means studies that are combined, for instance, 18 studies together for endoscopic gastroplasty or intragastric balloon. And within 12 months, both procedures are quite very significant in weight loss. For instance, 9 studies collected for endosleeve gastroplasty, 17% of total body weight loss was observed in that cohort after 12 months and 10.3% in the intragastric balloon studies. But much more important is what happened after 2 years. And that is really very impressive. While the endosleeve group or the endosleeve patients still maintained the weight loss of 17%, while after 18 to 24 months of follow-up, the total body weight loss for those patients who had intragastric balloon was only 6.8%. That means after balloon removal, let's say the possibility of weight regain is very high. So I would like to come back to the recent published study where they have in one center 2 procedures. And if we look on individual investigation data, you see that the total body weight loss in kilogram is less than 10 kilogram, much higher in the intragastric balloon group. And while in the endosleeve group, very little patients achieve only a total body weight loss of 10 kilogram. That means even in the individual observation study, you will see that the endosleeve procedure is much more effective compared to the intragastric balloon, even within 12 months. So, in summary, after 2 years, the endoscopic sleeve gastroplasty is much more sustainable with the observation of statistically 17% total body weight loss. What's about the new drugs? What is about the new pharmacotherapy, the glucagon-like peptide 1 drugs like Ozempic, Wegovy, or recently also on the market, tirzepatide or the Mounjaro. So those drugs are very effective in reducing the appetite, reducing gastric emptying, and also in reducing glucose production in the liver. So totally you will have a lower or reduction in glucose level. So as you can see, those drugs were initially invented to treat diabetes. But the observation was then made that weight loss is one side effect of those drugs. So Mounjaro, I mentioned already, in animal studies had shown also an increasing of energy expenditure. But we don't have long-term data. And in animal labs also thyroid cancer was observed in those studies. So even those drugs do not recommend or were not recommended in, let's say, patients where in the family were observed thyroid cancer. So the big question is also for those drugs, because most of the studies were only 12 months. And we have seen in the gastric balloon, 12 months is super effective. But there's one study very recently published in Lancet that if you observe them on a long term, the weight loss is less than expected. So initially weight loss of 14.8%, on a follow-up, on a long term, it's then only 8% for Ozempic or Wegovy. Mounjaro, I mentioned, is very effective in weight loss, but studies at the moment are only in a short-term follow-up, and in addition also not available in the European Union market. So only in some countries like in US or in Emirates, those drugs are available. And because they are so effective, and on the other hand, they are invented for diabetes, it's very difficult to get them. So they are very often not available on the market. What happened if you, let's say, stop taking those drugs? And there are also very little studies looking on that factor. We have seen that the weight loss in the first year is super effective. But as you can see in this graph, that the weight regain or the loss of this weight loss is extremely fast. So therefore, you would need this kind of drugs a lifelong, but as also mentioned, there are no long-term studies at the moment. So we should be really careful what happened on long-term with pharmacotherapy. While we have really good data on bariatric surgery, long-term follow-up, and also on endoscopic long-term follow-up. In summary, we have to be careful to rely on medication only. Because years ago, there were very effective drugs on the market, endocannabinoids, phentermine. And those drugs were then removed after a long-term observation that they had significant side effects on the cardiovascular system. The question is, what happened if we combine the endoscopic sleeve gastroplasty with the medication, with Ozempic, for instance? And even in that question, there are very, very little studies available. And as you can see, the little data we have, the weight loss to combine those drugs with the procedure is extremely effective. So the observational study that was published by Dr. Hoff was 26.7% total body weight loss after 12 months. So it remains who should get which kind of drug. And therefore, we really need to emphasize that the treatment of obesity needs to be in the hand of experts. Experts who have really long-term experience with those patients. And also experts that are working in teams like dietologists, like psychologists, like endocrinologists, and with doctors that have really a long-term experience. And treatment is not done with one part, is not done with surgery alone, is not done with endoscopic sleeve gastroplasty alone, is not done with drugs alone. So it needs to emphasize the entire, let's say, pathomechanism of obesity, which is multifactorial and therefore needs really high, let's say, dedicated and also very, very experienced teams treating that. Having said that, I wish you all the best with your intention, getting your weight under control, and in addition also get under control your associated comorbidities.